My name is Danielle Gladstone. I'm a pediatrician at Pediatric Associates of Whidbey Island in Oak Harbor. I've been practicing here since July. Before that, I was a pediatrician at Children's National Hospital in Washington, D.C. My patients are the wonderful range of people that we have living here in Oak Harbor, in Coopville, up in Anacortes, and all over Whidbey Island. And I also see babies at Whidbey Island Hospital, where I take care of newborn babies and their moms. I see kids from 0 days old at time of delivery, at time of birth, all the way up to 20-year-olds. During the last 2 years, I've taken care of a lot of kids with COVID, both in the hospital in Washington, D.C., in all of the ICUs, and here in Oak Harbor in the office. I've seen kids with very mild disease that have done okay. I've also seen kids that are incredibly sick from COVID, requiring endless support from doctors, nurses, physical therapists, respiratory therapists in the ICU. It continues to be something that we deal with every single day in clinic, testing endless patients and giving them advice and recommendations about what to do if they're infected or if they've been exposed to the virus. This experience has been overall challenging and frustrating. We know that this is a disease that now has a vaccine, a wonderful one at that. And every time I see kids come in who have been exposed, I can't help but think they could have been vaccinated, or perhaps they should have been vaccinated. We know that that's a really complicated question for a lot of families, but I hope as time goes forward, more and more kids are vaccinated and it changes the interactions that we have when kids are exposed to the virus or infected with the virus. This is not a political disease. It does not care about your political affiliations. You are a body and you can be affected. And really, all people are at risk, and thus all people should be vaccinated. We hope that more and more people start to see the benefits of the vaccine and the benefits of protecting themselves against an infection that has killed 5 million people across the world and 800,000 individuals alone in the United States. Unfortunately, we have seen an increase in cases in adults and in kids. We know that there have been lots of periods of the last 2 years where rates have gone up or down based on different factors like isolation or quarantine or increases over vacations or decreases in rates when the vaccines were released. But recently, in the last couple of weeks, rates are going up again in the country and are going up again in Oak Harbor. We know that it's spreading a lot in the schools. And so I have a lot of conversations with families about the importance of getting vaccinated so that kids who are in schools don't bring it home to their elderly relatives who then unfortunately end up in our local ICUs when they infect. In some cases, in our community and other communities, we've lost family members and parents as a result of these cases and been left with children that are now orphans or only have a single parent. So it's heartbreaking to me when families come in with COVID after I've spent tons of energy and time trying to convince them to get vaccinated. And I hope that as more and more time goes by, those families that I'm begging and pleading will go and get vaccinated. So why should you get vaccinated for a virus that supposedly has a very high survival rate? You should get vaccinated because you don't want to be one of those 5 million people across the world that has died in vain as a result of all of this. And you want to instead be one of those people who survives to tell this history in the future. 7 billion doses of vaccine is a much more wonderful statistic than 5 million dead. I am so glad that people have faith in their own immune system. That is great. You have been building it up for your entire life. But unfortunately, your immune system has never seen COVID. And as a result, when it sees it for the first time or the second time even, it's not ready to fight this virus off. It is as if you are a brand new baby with a brand new immune system. And even though some of the time people end up with a mild infection, very often they don't, because your immune system isn't ready and it's not built to fight off a virus this strong. I really like when people ask me about the timeline for this vaccine and say they've heard that it's rushed. This is one of the most researched vaccines that any of us have ever seen in our entire lifetime. And the science and technology behind it has been researched in multiple labs almost daily since that time. It's a wonderful coincidence that we had already done all of this hard work before this specific virus emerged. So all of this technology that's been worked on for a decade could be applied to this. And we had extremely rigorous clinical trials for this vaccine, more so than almost any other childhood vaccine that preceded it. I think my most important message when it comes to COVID vaccines is that it's safe and effective, and that it's recommended for everyone in the United States, so that we all keep our communities as safe as possible, because we really love and respect our neighbors, our friends, our coworkers, our families. So please talk to your physician, talk to the healthcare providers that you trust, look into the science, try to understand everything about this virus. And then if you have any doubts or insecurities or questions, ask us. As I always tell all of the parents here, even if you're not ready today, you can come back tomorrow and say, hey, I heard this thing and I want to talk to you about it. Or my friend said this, can I talk to you about it? I would so much rather anyone ever shares their insecurities with me and we get to have a great conversation. The COVID vaccines have been FDA authorized in the United States. That's wonderful. We know these vaccines are safe and effective. In recent weeks, we've also been able to start giving it to 5 to 11-year-olds, which for so many parents and so many kids all over the United States has been a thing to rejoice. These are kids that have been scared and isolated for so much of the pandemic, that have not been protected, that have been kept inside or kept out of school. And now they can too be protected. All of the clinical trials have shown that the vaccine is extremely safe and effective for 5 to 11-year-olds. There was no serious side effects in any of the major clinical trials. The 13% of American children that have already been vaccinated have done extremely well. And we hope that more and more over time continue to get vaccinated as their parents ask questions, learn more, and make sure all of their questions are answered. We need to take care of these small communities because we all care about each other. Someone that you see tomorrow could end up being sick the next day. And that's why it's on all of us to have conversations, not only in the doctor's office, but also in other places, encouraging one another to be protected, to stay safe, and to do all the things we can to take care of each other in our small communities.